Four Corners Medical Arts Center is a total healthcare facility located in the south end of Sudbury. An idea conceived and initiated by four local physicians, the Medical Arts Center is a unique achievement constructed and designed through the combined efforts of the public and private sector. Kingsbury Developments have employed state-of-the-art technology to create a building with an optimum level of comfort, efficiency, and professionalism for patients and healthcare practitioners.
I was one of the prime movers in establishing this facility in the south end of the city. It originated in July of 1988 when Sudbury began to develop walk-in clinics. We therefore got together, four of us, Dr. Bacher, Dr. O'Donohoe, Dr. Kutstruck, and myself, and developed a small walk-in clinic just down this mall, adjacent to the new medical building. And it was opened in July of '88. It's been a very successful venture. We're seeing anywhere from 50 to 90 people a night. It's been highly accepted by the community in this area. This area is very underserviced for medical facilities, and a majority of Sudbury's bedroom community is in this area. So it was a need that we identified that we filled. The next need we identified was that there was no medical facility in the south end. We then went to one of the major laboratories in Ontario and asked them to study it and to do a feasibility study. And they took 2 months to study it and decided it was totally unfeasible and turned the project down. We then approached a second lab, and we got a very favorable response. Within 2 months, the groundwork was laid. The doctors were brought on board. There were 11 original partners.
Good afternoon, doctors. Please call Dr. Sawtue, 673-7222.
And the whole thing caught fire in terms of the momentum and the enthusiasm, and we have never once looked back from that moment on. The other doctors came on. We had the Memorial Hospital join us, who's a major player in developing the cardiac rehab in this building. We have the Sudbury Physiotherapy Center setting up a 2,000-foot physiotherapy. We have Dr. McKibben, who's a new rheumatologist in town, who will be involving the Canadian Arthritic Society as a branch office in Sudbury. We have provisions for an X-ray. This isn't finalized as of yet. We have a nutrition counseling service in the basement. We have a full-service laboratory. We have a cardiac investigation unit, and we have multiple specialists and numerous GPs in the building. And we're now about 85% leased up, and so we only have a small amount of space. And I'm told that it's virtually unheard of that you open a building for almost leased up before the doors are open.
Dennis Timbro, Confederation Life.
As one who did serve as Minister of Health, I'm particularly pleased when I see the way that this building has been designed and the kinds of services which are provided here. Because some of us over the years have been preaching loud and long, and hopefully what I see here means that the message has been getting through, that there are ways for the public and the private sector to work together in the delivery of health services that in no way undermines the public sector or the goals which we all support for Medicare, but in fact brings to the fore the best of both sides.
Well, I'm very impressed. When I was Minister of Health, I used to encourage this kind of initiative where the private sector, working with the doctors, would come up with programs and facilities that would deal with the day-to-day walk-in medical needs as well as some of the program requirements. I think on the whole, it's obviously a very well-designed and well laid out facility.
We'd like to congratulate all the investors and the developers who have put their confidence in our community and in this particular facility. I know it's going to be a wonderful place for for the citizens of Sudbury to come and get services as required. So on behalf of all the people that I represent, I'd like to say congratulations and very best wishes for a good future for the Four Corners Medical Arts Center. Thank you.
Yes, we were one of the first tenants in the building ourselves in the after-hours clinic, which is right across the hall from us, opened up on May the 15th. And we wanted to open to coincide with their opening.
We've had comments from almost everybody who's walked through here as well. It's really bright. It's laid out beautifully, lots of windows. The air exchange systems in here, as I think was mentioned earlier, are new technology. The lighting is a new technology. I believe there was an Ontario Hydro grant to put this in. It's a very, very soft fluorescent lighting. It's not hard on the eyes. I think it gives more light and much less power. The ventilation, the air conditioning are all just working beautifully. It's a very, very comfortable and bright place to be.
Dr. Duncan McMillan, family physician.
But the building itself, one of the key points is the environment, because you consider we're working in the office at least 6 hours a day, sometimes more. The quality of the air is one thing I liked here. The air system and the way they were looking after exchanging air and then individual control of your heating and cooling in the units. Found that very helpful. Other features that are useful in the office is just finding that you have soundproofing, quieter, and the walls are sound attenuated, doors as well, so it allows for privacy. But here, I might say this is my third time in designing an office, and I think I've got it right this time. And it allows for just a more comfortable environment to work in.
I'm Chris McKibben. I'm a rheumatologist, and that means essentially that I'm involved in caring for people who have arthritis, rheumatism, etc. Certainly, patients with musculoskeletal problems have special needs with respect to access to office, things like that. And the nice thing about moving into a new building has been the opportunity to design a building or design an office setup that meets the needs of those patients in my practice. With respect to, the basic layout requirements, the building has been excellent, both in terms of responding to my suggestions and anticipating needs that, quite frankly, I hadn't even thought of.
As Executive Director of Sudbury Memorial Hospital, I'm pleased to be involved with this project, the Four Corners Medical Arts Building. The hospital obviously is implementing a new Stage 2 cardiac rehab program here to provide needed services for cardiac patients that come through our hospital, which is the Regional Cardiovascular Center for Northeastern Ontario.
This is cardiac rehabilitation, a program run by the Sudbury Memorial Hospital. This program will add to the continuum of cardiac care that is provided for the region and for the city by the Memorial Hospital. To date, we have run cardiac rehabilitation programming in the community setting for patients who are at least 3 months post-discharge. This Stage 2 programming will fill that black hole between discharge and the time they come into the community-based program down at the Sudbury Arena. The importance to us of being in a building such as this will give us a connection with the medical profession, because the patients that we're seeing are so soon post-discharge and traditionally can have minor complications that may need medical attention. Being in this end of the city is also important to the program because the target population that this program accommodates comes from a very large degree from the area serviced by this building.
With this particular project, it fulfills our role as a regional cardiovascular center for Northeastern Ontario, providing a full range of cardiac rehab services. And again, the building itself is an exciting concept. We're pleased to have so much space for cardiac rehab stage 2. We haven't had the luxury with our other programming in the past, and we hope we can do more on this site.
Truly is a dream come true. They said 3 years, but it's more like 5 years that this dream was first set adrift. And as I said in my remarks, it's a culmination of many people's dreams and aspirations. A lot of people dreamed about doing this, and I think there are still people today saying it can't be done. But of course, you can see the building here, and it has been done.
The Four Corners Medical Arts Center is an unprecedented medical facility located at 2009 Long Lake Road in Sudbury. For more information, please contact the Four Corners Medical Arts Center Management Office at 522-4507.